Have you ever experienced dizziness or lightheadedness right after standing up from bed or a chair, as if the room was spinning? Maybe it was brief or lasted long enough to make you sit back down until it passed. That's a classic sign of a condition called orthostatic hypotension, also known as postural hypotension. It is a sudden drop in blood pressure that occurs when you stand up quickly. In simple terms, your body struggles to adjust to the change in posture, and your brain doesn't get blood fast enough. Hey there, welcome to my channel. In this video, we'll break down in a very simple way why orthostatic hypotension occurs, the risk factors, as well as lifestyle changes and treatment options that alleviate it. So stick around. To understand postural hypotension, we first need to know what changes normally take place when we stand up. When we stand up, gravity pulls blood down into the legs and lower body. That sudden shift reduces blood pressure and slows down the flow of oxygen-rich blood to your brain. And remember, the brain doesn't joke with oxygen. Thankfully, the body has a built-in response system to compensate for this change. Sensors in our blood vessels quickly detect the drop and alert the nervous system. In seconds, the nervous system sends messages to the heart to start pumping faster and the blood vessels to tighten up. This then pushes blood back up toward the heart and brain. Within a few seconds, the blood pressure returns to normal. The brain gets its favourite food, oxygen, and we carry on without noticing. In postural hypotension, however, this system fails, and there is a communication failure between the nervous system and the blood vessels, which leads to a prolonged state of low blood pressure and reduced supply of oxygen to the brain. The result of this? Symptoms of lightheadedness, dizziness, confusion, blurred vision, and in some cases fainting may occur. These symptoms usually go away when sitting or lying down. So, what causes this communication failure? There are several causes, but common ones include 1. Dehydration and low blood volume. Vomiting, not drinking enough fluids, severe diarrhea, and strenuous exercise with a lot of sweating can all lead to dehydration. Basically, less fluid in the system means less pressure. Recent blood loss, such as after a major surgery, or chronic blood loss, such as regular heavy menstrual bleeding, can also lead to orthostatic hypotension. 2. Medications. Certain medications such as blood pressure drugs, antidepressants, and some antipsychotic drugs can slow down the body's reflexes. 3. Malfunction of the autonomic nervous system. That is, the part of the nervous system that controls reflex actions. This happens in conditions like Parkinson's disease and diabetes. Think of this as the body's Wi-Fi signal going down, such that the blood vessels do not get the message from the brain to tighten up. 4. Heart problems. Some heart conditions such as heart valve problems and heart failure can prevent the body from quickly pumping more blood when standing up. Now, in addition to these causes, certain risk factors can increase the possibility that you may experience orthostatic hypotension. Some individuals who are more at risk include older people, aged 65 and older, especially those who spend a lot of time lying down, people who have recently given birth, and individuals who have been on bed rest. How is it diagnosed? Postural hypotension can be diagnosed if your systolic blood pressure drops by 20 millimeters of mercury, or your diastolic blood pressure drops 10 millimeters of mercury within 3 minutes of standing up. For example, if your blood pressure sitting down is 120/80 and drops to 100/70, the diagnosis can be established. Though it can occur at any age depending on the cause, it is generally more common in older adults, and evidence suggests that about 28% of the general population of older adults suffer from this. Orthostatic hypotension is sometimes mild, but for many people it is a chronic problem that can lead to dangerous falls, fainting, or loss of consciousness. So, if you're experiencing dizziness or fainting spells often, It's very important to check in with a doctor as soon as possible to rule out a more serious issue. Now let's discuss the treatment. Treating orthostatic hypotension can be quite challenging at times because, as we discussed earlier, there are many causes. The main goal of treatment is to improve blood pressure once you stand up, without increasing blood pressure when you're lying down. If a medication is causing the condition, it is discontinued. If you're living with Parkinson's disease, diabetes, or another condition that is causing the orthostatic hypotension, treatment will likely be focused on treating that underlying condition first. Now, there are some lifestyle changes that have been shown to help people with orthostatic hypotension, such as increasing your fluid and water intake and limiting your alcohol intake if you're dehydrated, being conscious of standing up slowly, wearing waist-high compression stockings during the day, which can reduce blood pooling in the legs, and avoiding hot baths or long walks in hot weather. For severe cases, your doctor may prescribe drugs that work to increase blood volume or constrict blood vessels. To conclude, orthostatic hypotension is often the body's warning signal that its pressure control system is struggling. Understanding it and spotting it early can prevent falls, protect the brain, and avoid life-threatening complications. Please don't ignore it. Seek help early. Thanks for watching. See you in my next video.